Dear boomers, today I want to talk about Betty Ford and her diagnosis of breast cancer in the 1970s. But first, I want to read a comment from one of my viewers concerning the way older people are treated in the medical establishment. This is a very interesting comment. She says, I have talked loud when addressing older people with, huh? Many times it wasn't the volume, but clarity. So I have learned to enunciate better. And she says, my own fault for that one. One of the things that made me really angry is the parade of very old people coming in repeatedly for tests that are not needed. Women in the 80s coming in for mammograms and breast MRIs over and over after one false positive. These poor ladies can barely get around rather than enjoying their last years, maybe even not exactly their last 10 years, the doctors have scared the crap out of them and make them feel that this one test will give them everlasting life, which turns into several tests, then biopsies, then disfiguring surgeries, and all are time-consuming, expensive, painful, and take a huge toll mentally on these people. This is one cost. This is one cost that I feel is fraud on our medical system. If you really have breast cancer, it will be glaringly obvious, not some tiny spot. I guess that could be argued, but anyway, all of these very tiny spots that might be cancer will probably never do a thing. And if you are in your 80s, I can bet money that you will not die from that. I have read numerous studies on this topic and am shocked at what the world of breast cancer, quote, awareness, and quote, is pushing on women today. Same thing for the prostate bullshit they are pushing on older men. And then there are the people that really do have cancer. They are tortured beyond belief. They are repeatedly being tested and cut on, and chemo and radiation, to the point that there is no quality of life. I remember one lady that had so many surgeries, it was very, very sad. She was barely able to walk. She was unable to speak, all happening later in life after numerous surgeries to remove brain metastatic disease after other cancers in her body. I told myself that that was not the quality of life that I wanted. And if I ever find out I have cancer, the treatments will be very brief, if any. I am 61 and okay with it if I died before 70, if I were faced with possible poor quality of life as a result of life-saving surgery. I want quality, not quantity. So, getting back to Betty Ford, and I want to thank that person for commenting too. But Betty Ford had a legacy with the her breast cancer diagnosis, and also with her addiction work. I mean, she was an amazing person who'd made tremendous inroads in the way we view so many things in our society. But she was an iconic figure in both American history and the history of women's health. The breast cancer diagnosis of Betty Ford, she said that she was a trailblazer, but she also was pretty much depending on male doctors. There were other alternatives rather than mastectomy for her. But she went with that because of what the doctor told her. And when they called her on the phone to talk to her, she pretty much went, it was like what she wanted to do wasn't really discussed. And so she went, one day she was living a rather normal life, and the next day she was on the operating table having a mastectomy. So, breast cancer in the 1970s was often shrouded in secrecy, with many women too embarrassed or to speak about it openly. And I do feel like the same is true today. People feel like it's some sort of weakness. They feel that people will look at them differently. And in fact, I believe they might. Um, Betty Ford did share her decisions on treatment in 1974. One day she appeared to be fine, and the next day she was on the operating table. Um, so Mrs. Ford underwent a traditional radical mastectomy, the common treatment of that era. And I still think it's a treatment today. You know, let's look at it in terms of how women are treated in our society, and that's only getting worse. Hopefully, that will be getting better. Um, Her treatment choices were dictated by male doctors, and actually today we have more female doctors, and I have noticed in last year that the women doctors are not proclaiming treatment. What this is what you need, like the men of male doctors of old. And in fact, today it's almost like if you really want to know what this your female doctor wants thinks that you should do, you ask the question, well, what do you think? What do you think I should do? Often they'll say, I want you to make the decision. They give all of the options, and I want you to make the decision, which I think, in the case that I'm thinking of, was just a little frustrating. Um, so, um, this was the prevailing medical approach at the time, but it did spark a feminist debate about women's autonomy in healthcare decisions. Um, there was a woman named Rose Kushner who tried to persuade the White House to reconsider the invasive procedure, and that was not to be. Um, the openness of Betty Ford led to a surge in breast cancer screenings known as the Betty Ford blip, where many women were inspired by her story, rushed to get mammograms and breast exams for the first time. The legacy of early detection was pioneered by Betty Ford, and the early detection through mammogram. Her diagnosis was not an example of catching cancer early. In fact, her tumor had already spread to her lymph nodes, and she likely survived because of her chemotherapy treatments, and she died at age 93. So modern research shows that there is no one-size-fits-all solution for breast cancer or for probably anything else, right? Many factors like the biology of cancer play a larger role in survival than simply how early it is found. And also your family history and your lifestyle, even though these things do not guarantee much of anything. In my opinion, I mean, also the way we feel about the cancer. Do we see it as an enemy, or do we see it as something that we can learn from? There is false positives and overtreatment, and they are recommending women in their 40s are to get mammograms, and where because of dense breast tissue leads to false positives, unnecessary biopsies, and stress. Breast cancer screening guidelines have evolved over time with debates about when women should start mammograms, and now they're doing it earlier. The risk of overtreatment is also a medical controversy. So we have celebrity illnesses, and Betty Ford's story did inspire hope and action, but exemplifies how celebrity health narratives can sometimes oversimplify complex medical realities. So she was very brave, Mrs. Ford, and her bravery remains commendable, but her experience also demonstrates the need for critical, individualized approaches to cancer detection and treatment. There's ongoing debates in breast cancer care. They continue to explore the balance between finding cancer early and avoiding overdiagnosis and overtreatment. We can discuss how modern cancer treatments aim to tailor decisions based on individual factors like age, genetics, tumor biology, and moving away from a one-size-all model. So she was a pioneer, and maybe she didn't want to go through all of the different advice that so many people like to give when they learn that you have a cancer diagnosis. They like to tell their stories, and they like to tell their war stories. And that's maybe why people don't reveal their diagnosis, because these stories bring down your vibration. And what you want to do when you're ill is to raise your vibrations with hope and bravery and triumph. And so I can see why people don't share their diagnosis. It gets to be too much. So we have to, I am encouraging you to educate yourselves and talk to your doctors for sure about screening options, and advocate for your own health and treatment choices. There's going to be a video that shows up right here. Take a look. And I encourage more comments. I appreciate the comment that I just read. And subscribe, please. Bye-bye.